Welcome back. I'm Don, and today's video is a day in the life of an LCSW. Today marks 6 months since I've been employed at a major academic hospital, so I thought I'd vlog. It kind of feels like a dream deferred because my concentration was healthcare with a specialization in oncology social work. I've already checked my email and voicemail, so now I'm reviewing my pages and I'm going to catch up on documentation. Now I'm logging into Epic, which is the electronic health record used at this institution. There's a message regarding a patient from yesterday. This is where working part of an interdisciplinary team comes in because this patient is being cared for by multiple providers from different disciplines. So I am taking the time to message the patient's medical team to update them on my progress and to provide recommendations. There's a framework called quality improvement that's used to systematically improve care. This is relevant to social workers because we aim to increase the likelihood of desired health outcomes for our patients. Before I contact or visit each patient, I review their chart to identify previous, current, and ongoing needs to assess the progression of their case. We're often managing multiple cases, so sometimes I may complete a task for someone who didn't get to it, or relay a message, or check in with a colleague to offer assistance. Patients appreciate follow ups because they feel cared for and tended to, most of the time anyway. This increases patient satisfaction and can help prevent issues from becoming more complex, which saves everyone time and money. Now that we've reviewed some of the behind the scenes of what I do and its rationale, I'm going to walk you through a live call. This is a real call without revealing any patient information and without violating any HIPAA laws. So stick around and enjoy this live call. Morning, my name is Don Lampkins. I'm a clinical social worker with supportive oncology. Is available. Hi, I was hoping to touch base with you regarding a positive distress screening during your visit yesterday. Is this a good time to touch base? Great, I appreciate that. So I wanted to just follow up because it's routine for our providers to inquire about the overall well-being of individuals during their visits. And so that may come in a form of being asked about distress levels or being asked about anxious or depressive symptoms. And it looks like when asked about distress and if you're experiencing any, and at what level, it looks like you rated yourself at a 7 for distress. And so usually we like to follow up with anyone who scores or rates themselves at a 5 or above for distress. And so I was hoping to follow up to learn a little bit more about that. I know some patients may refer to distress as pain, so we like to just get clarity and make sure that the proper resources are in place and the proper services are being provided, and if they're not, making sure we fill that gap in any way we can. And so when you do you recall rating yourself at a 7 yesterday for distress? Do you mind sharing a little bit more about what was going on for you to rate yourself at a 7? Mm-hmm. Are you able to contextualize the type of abdominal pain you're experiencing? Yeah. Okay. Yeah, absolutely. So it sounds like it's a medication that's administered here during your infusion treatment. Oh, yeah. Oh no, that's horrible. I'm sorry for that. Yeah. Hmm. For sure. So what I'll do is I'll make sure to message you via my chart so you can have that reference for our supportive oncology services as well as my contact information. And if you need, right, yeah, it sounds like you need the numbers, and so you're. It sounds like you're waiting for those results. Okay, so I can definitely follow up with your provider to let them know that you're anticipating those results, and then I'll also just send a follow-up message to you of the supportive oncology services available, along with my contact information. So if you have any other questions, or maybe you need me to serve as a liaison between you and the providers, I'm more than happy to serve in that capacity. Okay, is there anything else I can help with? Yeah, I hear you loud and clear for sure. But I will be sure to note that. Well, thank you so much for your time. And if you need anything, this is a number you can reach me at. Reviewed it, and the person is at a different location, so I will have to give them a call later today. I usually like to wait an hour or two to make sure that they're done with their service, they've made it home and had time to settle in before giving them a call. And so sometimes, depending on my day, that'll and depending on when I find out, I'll either be able to speak with that patient the same day if they answer, or I'll speak with them the next day. So I just called the patient. They were at work, so I asked if I could send them a message via my chart, and they agreed to that. So my chart is, if you have ever had an appointment at a major hospital, this is where your hospital communicates your results and different things of that nature. This is where your provider is able to communicate to you, and you're able to communicate back, see test results, things like that. So check your my chart, people. Okay, it is a valuable resource. So I'm going to send a message, and it basically just lets them know what I was calling about and what supportive oncology services we have available, and if they're interested, what they can do to be connected to services. So I just got off the phone with a patient, and they were interested in psychotherapy, but they live in a completely different city. So we sometimes we recommend folks use a psychotherapy based directory, or Google, to find therapists nearby their home, because some people don't want to be seen virtually, some prefer to be seen in person. So it's a hit or miss if they are in, depending on location, are able to be seen by us. And so sometimes it's getting them connected to therapists here, other times it's empowering them to seek out that care by someone that's close to them, and just giving them the tools to vet therapists and things of that nature based on their insurance and needs and locations and things of that nature. But by the end, the patient was like, maybe I'll come. Would I be able to see? So I know that a lot of this vlog has been me sitting at my desk, but there's a lot of things happening at this desk. So I hope that it is providing you some useful information. So I'm getting ready to call a patient now. And one thing about this role is that since I work at a cancer center, I may see patients again and again, and so it's hopeful to review notes prior to contacting them to ensure that I'm not calling without accurate information. Hey, I'm getting ready to provide a psychotherapy appointment to a patient now. I will debrief you all on that afterwards. Hey, so I'm getting ready to go see a patient now. They're in our cancer urgent care. We have an urgent care to help patients receive specialized urgent treatment without having to wait in the ED for long periods of time. So there's a patient who is reporting not feeling safe at home, and so I'm going to go speak with that patient to learn a little bit more about the situation. I was actually paged about them yesterday, but I was off, so they are here today. So I will definitely ask about where they stayed last night and how that went to see if that's a reliable resource to reinforce for that patient. If not, then there are some shelters that I will connect the patient with, and many shelters have case managers there. This patient has a dual diagnosis, and so whatever happens, I'll be sure to update their providers because they're receiving substance use treatment here, as well as mental health treatment, and they're following through. They have a long history here, so it's nice to see that they are utilizing services, and hopefully it has an effect and is contributing to our psychological insight for today's visit. So that concludes this video. If you like it, please give it a thumbs up. Be sure to subscribe to the channel, share with a friend, comment below, and be sure to turn on your notification bell so you can be notified of more videos like this.